I would love it also if we were able to get electronic in the practice. I think it would be great. It would really streamline it. Clinically, we could see more patients. We'd be able to prescribe quicker and more efficiently, and that would also help the bottom line financially. I think that would be a lovely idea.
Ideally, I would love to be able to have the computer in there and do it all at once, but in order to do that, the cost would be prohibitive.
I would, in a blink of an eye, begin the process of converting over to electronic medical records were it not for the finances involved in it.
I'm really interested in getting an electronic health record that allows me to track a lot of different parameters on people to find out which of my patients haven't had mammograms in the last 2 years, who I need to recall for blood pressure management, who isn't in very good control. I think that's going to be a really important function of electronic health records.
A recent ACP membership survey showed that about 20% of ACP members in small offices are using an electronic health record, and 2/3 of paper-based practices have considered purchasing one. The decision to make the leap to an EHR is one that requires considerable planning.
The whole process can create stress and challenges for a practice. We spoke to Dr. Fincher and her office manager, Ms. Shivers, to learn about the process they went through for their 4-physician practice. A decision was made. How was the decision made and who made it?
It's interesting because Jamie and I were basically able to narrow it down to about 3. And then the more we looked at one, we went and did site visits, and we included the other partners, different staff members. So we all went and looked at different computer systems in action. At that point, we knew we had a great long-term company. We knew we had a good product that would match up with the practice management system that we already had. And basically, we just sat around the table here with the 4 doctors and Pam and said, this is what we've come to and this is what we think we ought to go with. And we looked at the financing and said, we're ready.
I'm wondering, in your transition, have you noticed any sort of problems or stumbling blocks towards adoption or acceptance of the fact that the practice is now using an electronic medical record?
When we changed from the paper system to the electronic medical record, that was one of the steepest learning curves I've ever been on. And having gone through medical school and training, this was still one of the steepest because, you know, it really just was not intuitive as physicians. And I think that's one thing that is really a challenge for physicians going from paper to electronic medical record is it really changes that workflow and how you do things, and it is just an absolute change. Thinking about it, everybody was kind of on board with the idea, but you know, on board with the idea, and once you start implementing, it's 2 different things, because when you start implementing, you know, the rubber meets the road, and it is hard, and it is stressful.
And they've asked for charts back. Pam, I need my chart back. And I'm like, no, you're not getting it, I'm sorry.
One of our partners really didn't like it, and honestly, we have drug him kicking and screaming. But it's helped him more than it's helped anybody, because he spends a lot of time with his patients. He documents all this stuff, but he was always afraid to overcode.
Well, the key point, though, is you did a lot of research, did site visits, and you made it a decision collectively.
You know, it's one of those things where just to keep growing and being open to change, that's hard for us, but necessary.
Dr. Fincher described the adoption of an electronic health record, and that EHR is now central to their practice operations. Practices also use a variety of other technology solutions to support their operations, such as managing tasks, supplementation of patient histories, and e-prescribing. Here are some examples of these technologies in action.
We run a report with patients who have not been seen in the last 120 days. The registry will give us those names, and then we are able to look to see if they have an appointment scheduled. If they don't, then we give them a reminder call. It has helped the staff as well for us to follow up when patients have chest x-rays, MRIs, that we need to make sure we get those results back. The staff is able to send themselves a task due in a couple of days, look for this MRI result.
What instant medical history allows us to do is have the patient work on developing his or her history and having the software ask them questions about it and have me be able to come into the room having looked at a published history. My patients can fill out a questionnaire either at home on the web or here in the office.
We've created a more extensive patient questionnaire. So when they bring that in, we have almost all the questions that we would ask in an interview in the same format that's in our EMR.
It's a personal family history form that the patients fill out the front and the back, and it's like a bubble system. They have to bubble their answers in, on the front and the back, and then I scan them into our system. I mean, it automatically goes into EMR.
I just think it's neat to come in and the doctor can pull up your chart and look at your history, and he can go all the way back from day one since you've been here, and it's all accessible. And then he can punch another button, send your prescription to the pharmacist, and stop by and pick it up. It's just really made it nice.
What pharmacy do you use? And they'll tell me. I'll jot down the information in the chart, and before they actually leave, as they're processing out, it'll already be sent to the pharmacy. I'll type it on my laptop, and it direct connects with the pharmacy. It'll be there before they get there.
I'll write their prescription, click in the computer and say, oh, you're not writing any prescriptions. I said, oh, yeah, you will get it, because it's new for them. So once they start going to leave, I go to the other room and pick up their prescription, sign it to them. Oh, wow, that's, I can read it now.
Well, their prescriptions, they're plain and they're readable and all and everything else, and I'm satisfied.
Do you miss his bad handwriting?
Well, we all got our faults.
These are just a few examples of the way practices use technology to support patient care. For more information on EHRs, e-prescribing, and other technology-related topics, please visit ACP Online and go to the Running a Practice section.